So, welcome to Extraordinary Lives. Today, I've got Dr. Price and his beautiful wife, Kerri Price, his biggest supporter. And I'm going to let him introduce himself because, who can do it
Yeah,
better?
perfect. Well, I'm a chiropractor and a father of five, and a little bit of what I do, I focus a lot with kids who are struggling with a variety of things. A lot, primarily in a neurodivergent community that are struggling with ADD, ADHD, even as far as sometimes where it's progressed to where they're having seizures, or even a lot of special needs community, several patients with dystonia, a variety of issues that all comes down to an underlying functional thing we need to work on is with their nervous system and balancing their nervous system and how they're functioning, especially with what's called your autonomic nervous system and the difference between a fight or flight and this resting healing response. And the easiest way to think of it is many times these kids are literally just stuck in fight or flight. Their nervous system doesn't know how to shift or transition between those, and they can't get the full benefits from so many therapies, so many different things that they often do need because their nervous system's just stuck in this place. And that is what we specialize in, is literally helping these kids get unstuck so they can progress and reach their maximum capacity.
That's amazing. So, go back and tell
I'm
me.
chuckling a little bit because it's like you already went into doctor mode when you're like,
Yeah,
introduce
that's
yourself,
great.
and he's
Yeah,
like,
I'm
fight
like,
or
oh,
flight,
I'm
rest
going
and
into all
digest.
that.
But
Yes.
that's great, though.
No,
because
I
it kind
love
of leads us
that.
into, so
Yes.
people understand, right? When you say chiropractor,
Yeah.
they always go to thinking that, oh, you crack backs and it's like a 10-minute at the most thing and then you leave. But the fact that you do so much more, and that's why I want people to understand today, especially people with special needs children and caretakers too. So I want to get into
Yes.
that as well. But tell me how you decided or what led you to this path.
It's a very involved, long story in that my oldest brother was born with severe disabilities. He was deaf-blind. He had so many different obstacles and things that he overcame in his life, but that really were things he had to work through. And watching him struggle through so many of those things and actually seeing chiropractic care help him is a lot why I became a chiropractor. I mean, one of the biggest things that always has stuck out to me, part of his life, he was getting the migraine headaches. And I just have these visual memories of when he would have his headache, he would start putting his head through the wall
Just
and literally putting his head through walls.
both out of frustration and just putting like this
Yeah.
hurts already, like I can't take it anymore.
Yeah.
He just
and
didn't know
can't
how to
speak
handle it.
and verbalize what's
Yeah.
going on. So that was his way of showing.
His communication, we would do what's called tactile sign.
Okay.
So I spent a year with him at the Helen Keller Institute.
Oh, wow.
And so I went out and helped learn and help train and how to communicate with him,
Okay.
doing that tactile sign. And so we did quite a bit with that. But he was amazing in that he just understood people. And he could understand someone he knew he could communicate and would understand him immediately.
Oh, wow.
And so there was this communication. I was always able to understand him very well. And that was a lot where I was able to go with him to the Helen Keller Institute and do different things to help support him. But when he would get these headaches, I mean, it was just shut down. There was nothing you could do to help him other than just trying to help you so he wasn't hurting himself because he was in so much pain.
Sure.
Yeah.
Well, I suffered from migraines for many, many years, and not to be able to verbalize how bad it hurt would be so frustrating. At least I was able to talk and get help and go get, and tell people like, hey, I have a really bad headache, or go to the doctor, emergency room, or what have you. So I can't imagine having that kind of pain and then not be able to communicate that. What's the age difference between you and what was the age difference?
Let's see. I'm bad at thinking about that.
So he was the middle brother and Danny was the oldest.
Yeah.
But I think your mom had a pretty back-to-back because like
Yeah.
18 months. So not too long.
No,
Yeah.
it was just a
Uh,
6-year difference.
Yeah, because he just had his
Mhm.
50th birthday. So you'd be
Well, we had-
like maybe 3 years.
There was a couple years difference, but mainly because, well, long story short, they had told my mom and father that they shouldn't have any more kids
Oh, after Danny?
because they said all your kids are going to have all these disabilities.
Just
So don't have
there
any
was
kids.
really probably no proof, but they just assumed.
That
Was
was
that even an
just-
assumption
yeah.
then?
Yeah.
Because he did have some genetic things that were tied to his disabilities.
Right.
and this is a lot where I specialize now. And I've talked to my mom, even going back retrospectively, a lot of his disabilities were totally related to the birth trauma when he came into this world. I mean, my mom related to where he was stuck in the womb, and even her OB had told her we've got to get him out or he might die.
Wow.
So they used forceps.
Okay.
Okay, and this forceps extraction, her OB literally told her later, this part of his disabilities, he had cerebral palsy and different things that were tied to some of his disabilities, that the birth trauma had a huge impact and probably created those issues. But like she said from her story, it was a point to where with the labor and everything, it was like either get him out or he could die in the birth process.
Right. Like what's the lesser
Right.
two, right?
Exactly.
Yeah.
So it's not like, hey, demonizing the doctor or my mom and anything in those things. It's just like, hey, this is part of his story.
Right.
That really understanding where he was. And yes, he had these genetic things that created disabilities for him, but he had even those compounding factors from that delivery process.
Yeah.
And a lot going back and studying his history really has helped me understand better how to help him, how it would have been able to help him or help others. He has passed away, but
So sorry. Yeah.
yeah, he lived an amazing life. I mean, you look back at his story, he wasn't supposed to live past a week, then past a month, then a year.
Wow.
Then he lived till he was 21.
Wow.
29.
29, sorry.
Okay.
29. So I'm bad with remembering numbers. But he lived till he's 29, and he had accomplished so many different things. I mean,
That's amazing.
he was a stubborn personality where he persisted in overcoming things. Because of his disabilities, he actually had his ankles were fused.
Wow.
So he had no ankle mobility at all.
Oh, my
They were
gosh.
just one solid bone.
I can't imagine trying to walk that
Yeah.
way.
Well, he
be
wasn't
mobile.
supposed to be able to
Yeah.
walk, and he wasn't
was-
supposed to be able to do a lot of things.
So you say that he lived this amazing life, and it sounds like he did, but he's left a legacy because what you've done, in his honor has been so huge, and then to have Kerri support you and be a part of that journey and business partner as well. I mean, what
Well, I
a
think you should
amazing
get
thing.
into when he started to get chiropractic care
Yeah.
is when Danny really started to thrive.
Okay.
I mean, with his severe disability or with all of his genetics, predispositions that he had, I feel like that's where his mom and his whole family started to see him really thrive,
So they
even
saw
with his
the improvements.
disability.
That's amazing.
And that's what kind of led him to want to be a chiropractor.
Yeah.
It was him getting the chiropractic care. I mean, it helped with his migraines.
So
And
who
he
decided,
on-
or sorry, before we go back there, like
Yeah.
how was he referred to a chiropractor, or how was that brought up? Because I mean, imagine like I have a special needs son, right? And none of the doctors, nobody's ever told me go see a chiropractor, go take him to a chiropractor, right? And so, by the grace of God, I met you and you
Yes.
helped me, and then we'll get into that.
Yeah.
But so, how was he referred to go?
So a lot of that comes into my mom was amazing in always refusing to just accept, hey, the medical model only is the option.
Okay.
And a lot of that became because any medical treatment he got, he would get extreme reactions.
Okay.
So he never reacted the normal way to any medical treatment or any pharmaceutical treatment, especially. I mean, one story that sticks out to me, he got a bacterial infection, so he needed antibiotics at one time, okay? And it was a very mild dose of amoxicillin, and he got diarrhea from this antibiotic.
Okay.
That's a normal reaction, but he got diarrhea, and the diarrhea he got out was so acidic that actually gave him burns on his
Oh
body.
gosh.
So, in third degree burns, just burned his skin.
Wow.
And the doctor didn't even believe it was possible. We had to show him this is what happened.
Wow.
And he still didn't understand how this happened. But my brother was that person. Like
Yeah.
everything you'd try from that medical chemical model, he did not respond well to. So my mom, like even when I introduced my wife to my mom, I joked calling my mom the witch doctor.
Yeah.
Because she studied books of homeopathy, herbs, everything you can imagine to try and figure out how to help Danny.
That's so amazing.
And she could teach courses on a lot of those things because what she dove into and actually learned just to working through this process of helping. Because of going down that road, she was introduced to other therapies and other options. And of course, because Danny was getting headaches, chiropractic care was an option
Okay.
that started to explore that. But it wasn't just that it helped him with his headaches.
Right.
That's not what stuck in my mind. It was more as I watched him get chiropractic care, I watched him become unstuck, meaning he wasn't just getting pain relief, he would be more aware, more his communication would improve.
Oh, wow.
His life was improving because of chiropractic care.
Okay.
Okay. And you can, and I looking back, especially knowing what I know now, I see how much his nervous system literally just functioning better as he was getting that care.
Right. Because he was getting out of that flight or flight mode because of that.
Exactly.
So, which is so fascinating to me because when you think about people with special needs, and, of course, it's obvious that they would have, trauma, and then they have things that they have to work up. They can't sit the way that we do. They can't move the way they do. We can't, there's so many things. A lot of them are, nonverbal. And so, and then just their nervous system's just on overload at all times. But then the caregivers are the same way, right? Because what their child's going through, what their loved one's going through, they also go through it. And then they also have the physical aspect of it as well. So was your mom receiving chiropractic care? Did she look at herself or?
She is now because I'm forcing and pushing her
Yeah.
to.
I
She's
think the
very
caregivers
much,
always put themselves last.
yeah,
Right.
she's very much that caregiver that put herself last and just took care of me, my brothers, and Danny very much first. And so she always was the last. And now she's really trying to backtrack and help heal from so many different things and move forward. And I'm helping remind her to do certain things and helping push her down that path. And it's really helping with her. But yes, she spent so many years not taking care of herself.
Yeah. It's easy for us to do where you just don't think about it. Like you said, Carrie,
Yeah.
the mamas always put the babies first
Well,
and
especially
stuff.
when you have, we have so many moms in our clinic, and I might get teary eyed, but gosh, the stories that they have and the things that they have to go through daily that I have never had to as a mom, just from eating food to tying their shoes, getting them dressed. It's like, it has to be so exhausting to these moms. And that's why our practice is we consider as family care, because we really want to see the whole family. Of course, we usually see the child first,
Yeah.
but when they start to notice all of the amazing benefits and honestly, we call miracles that are happening within their own child, they're like, well, I need this. Well, of course you need this because you've been stuck in fight or flight taking care of this child.
Right.
And, he was just talking about a mom now in our office that, she doesn't wear long sleeves anymore because her son no longer bites her.
Oh,
And it's
wow.
just
So
simple
amazing.
things like that
That's
I've
not so-
never
that's
been
huge.
able
Yeah.
to wear a short sleeve shirt, but now I can because my son doesn't have the aggression and he's not biting anymore because of the care that Dr. Price is giving. And for me, I've never had to do that. I get to wear the clothes that I want, but for a mom to cry that she gets to wear the shirt that she wants now. And thinking of things that I take for granted, I always get to choose the shirt that I want to wear.
Yeah.
But moms that have those type of children, they sometimes don't, and they're always on guard all the time, right? And just to be able to relax, and she's like, I get to wear the shirt that I want. I want to wear this cute shirt that doesn't have long sleeves. Isn't
that's
that
amazing. Those
things
are, and like
that.
you said, small miracles. I think
Yeah.
that, having Riley, and he's 18, but he's more like a 9-month-old. So it's like for many years, I felt like I had like a 15, 16, 17-year-old newborn because I was doing everything for him, like changing his diaper and feeding him and
Yeah.
doing all the things. And now he moves around and he's great. But what I saw coming into you was it was for myself. I had a torn shoulder and all kinds of problems, and so you helped me. And then I think when Dr. Price sat me down and looked at my scans and said, you've been in fight or flight mode for so many years that no matter what I did, whether it was massage therapy or if I was taking supplements to help me or whatever, my body wasn't able to absorb that because it was stuck. And so when you explained that to me, it totally made sense. I'm like, okay. And then I started seeing so much better relief, and I didn't have to go get surgery, which was a huge thing for me because there's no way I could take care of Riley with shoulder surgery, right? But then bringing in Riley to you was such a huge wake up because he's nonverbal. And so I couldn't verbally know if he felt better when he left your office, right? It would have to be like, okay, time will tell. And I could tell that he felt more relaxed and stuff. But the one time that I remember the most that was very apparent to me because we hadn't talked was when I took him on vacation last year. I took him to Arizona for a spring break. And he's always loved going with us and stuff. But he had moved from a group home And then, so we had got him from the group home for the weekend and took him to Arizona. When we got there, everything was great. He went to bed and he was great. We got him up in the morning and his self, and went to breakfast and came home and we went swimming, and I put him down for his first nap. And I always close the blinds, everything, so it's nice and dark in there. And my husband comes in, he goes, I don't think Riley's sleeping. I'm like, that's okay, as long as he's resting, that's what he needs. He goes, okay, but you might want to go check on him. So I went
Yeah.
to go check on him, and I opened the blinds, and he had been crying, like sobbing quietly to himself, like just tears and snot,
Oh.
and I immediately hugged him, and then as soon as I hugged him, then he started like doing like the
Yeah.
hyperventilating and
The
like really
sups is
sobbing.
what I
Yeah,
call them. Like,
yeah,
yeah.
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 And I think what he thought was that this was his new home and he was
Yeah.
going to move again. So that trauma of like, why am I here? This is not normal. It was an Airbnb, so it wasn't a place that we had been to before. And when we've gone on vacation with him, we've always gotten two beds and he sleeps in one and we sleep in the other. That way he knows we're in the same room. So the only other time he's not slept with me or in somewhere familiar is at the group home when he first moved there, right? And again, not being nonverbal or being nonverbal, he couldn't ask for me. He couldn't understand why he was there. He couldn't ask those questions. But when we brought him back, so the next day we checked out and he seemed to be fine. We took him to a movie and he fell asleep in the movie, which is very unusual for Riley to sleep anywhere. I mean, we can go on a 7-hour drive and he won't sleep. He's just like happy to be looking around.
Yeah.
But he fell asleep in the movie, so I knew he hadn't been sleeping, and I knew that just that trauma, I think that emotional wear and tear on him, right? So I remember coming home late that night, and then Thursday morning, I brought him to your office. I didn't post anything, so nobody knew that he'd had this experience. I just brought him on a normal appointment, and the one thing you asked me is, "Had Riley has anxiety?" And I looked at you, and I'm like, "What? How do you know that?" And I think you said it was like in a C4 or something, and I'm like, "Yeah." And then I said, "Well, he hasn't had a bowel movement since Monday, and this is Thursday, which is again unusual for him." And I remember you adjusted him and stuff, and I still was like, "How did he know that?" We came home, and Riley had his bowel movement, and then he slept for 10 hours straight. He was just so tired. So the relief you gave him, and the fact that that was the first time that I could really see, like, because you take your intake, right? And people go, well,
Yeah.
he's got this and he's got that and blah, blah, blah. And then he can
Yeah.
kind of engage, but you didn't know any of that. And so the fact that you did was like, okay, I already believed in you before, but this was like absolutely 100%. He knows. So I
Yeah.
want you to talk about that and how
Yeah.
you know it and just how you can give parents I'm a big advocate, right? Because I've seen what it's done
Yeah.
for me and for Riley. But how you can tell, because so many people are very pessimistic when it comes to chiropractic care, I think.
Yeah.
They just feel like, oh, I can get paralyzed and I can get this and I don't want my kid to do this. So I want you to really elaborate on that to
Yeah.
put mind at ease and obviously have people still ask the questions and stuff because they need to feel comfortable. But I think
Yeah.
that you talking about it and knowing how that works is important.
Yeah. Well, especially that day. I mean, one of the big advantages I already knew Riley,
Yeah.
so understood and get used to actually, hey, here's the pattern how your nervous system's usually adapting to it.
Okay.
And all of a sudden you see this huge shift. Everything's totally different.
Wow.
That's the number one thing. I'm like, something's different for you today.
Okay.
So that
But
was
you
the
have to
number
talk
one
about
sign.
how you feel.
Yes.
So he palpates and
This
feels.
is
Yeah.
getting
Yeah.
to that.
Okay.
So that's palpating is a
Yeah.
fancy chiropractic term. It's just literally feeling. Hey, how's
Okay.
it moving? What's going on? And then taking temperature readings. There's several things you can look to help get information. Because yeah, Riley's not telling me
Right.
verbally what's going on, but his body's literally shifting. So you can see different shifts in his posture. The tension is completely different, and really tying to his C1 to C4, just a compensation zone. But it was just completely different pattern for him.
Okay.
And so I was like, I've never seen you like this and the tension this way.
Wow.
And so I was like, it's different. Something's got you amped up, anxious, and you can't relax.
That's so amazing because at this time you weren't even seeing Riley regularly. I mean, it was
Yeah.
when we go out and back and we could get him in. So I would say like maybe once a month if we are lucky, maybe once every 6 weeks. And so
Yeah.
for you to know that and not have him like he was just there 2 days ago and he's so different, or he was here last week and so different. I mean, but
Yeah.
probably a month or even more.
Yeah.
So that's amazing that you can feel that and know that that was the issue. So thank you.
And you're welcome.
Yeah.
The biggest thing is then, hey, people are always uncomfortable. Like, hey, how's he going to adjust? Adjusting him so gentle and easy. That's the biggest thing that's often a misconception too. Is, hey, what adjustment's necessary for each person? So related, hey, that muscle tension, everything's so tight. the adjustment was super gentle because I'm not fighting his muscles. I'm actually working with those and helping unwind that tension. And I think that day I used what's called more of a sustained contact adjustment, where I'm literally just we worked on that C1 and C4 and just holding those and holding them as the muscles relax. And you can just feel the muscles just unwind with that tension. Okay.
Yes.
And then especially for Riley, if you have this upper cervical tension, so this tension's so tight and he's in a wheelchair, so he's not moving, so he's not getting sacral stimulation. So you have a whole bundle of nerves, your sacral plexus, your tailbone, as it moves, it stimulates these guys. And this is one of the biggest things that helps motility and getting bowel movements.
Okay.
So you have this tension wound tight and he's in a wheelchair.
Right.
So he doesn't get a lot of stimulation to there. And he has this tension literally pulling on what's called your dura mater. So this is connective tissue that goes around your brain and your spinal cord. And as a healthy individual without disabilities walking, literally your sacrum moves and the tension on this dura mater pumps cerebral spinal fluid all the way around your spinal cord and your brain. So now if you're sitting, you don't get that stimulation.
Right.
And you're also getting this dura mater that's cranked tight at your neck, so tight. So then he has no movement there. So of course he's not getting stimulation. He's not having bowel movement.
So people that have cerebral palsy, for instance, and
Yes.
like Riley does have cerebral palsy, but he's not as extreme as some people where they are, Riley's pretty mobile. He can crawl around and he can move a little bit, but doesn't walk, like you said. So somebody that has cerebral palsy, I mean, is this a good avenue for them to get care as well?
Yes.
Okay.
So that's just think of the local area, the tailbone not moving as well. So that's just a very physical, easy to represent and understand. So I often explain that because it's easy to, hey, that makes sense. But also when it's not moving, your nervous system's not getting information from there moving.
Right.
So this is one of the biggest things that drives our nervous system into this fight or flight mode.
Okay.
So the nerves that tell your brain how you're moving or not moving, they are very noisy to your brain. So anyone who's ever gone to physical therapy and you use electrical stim,
Yes.
where they hook up these electrical pads, pulse electricity, and make your muscle twitch. And if you do it around an area that's causing pain, you stop feeling the pain. Okay. Now, the misunderstanding, or it's often not explained, the pain is actually all still there.
Right.
You don't feel it because the muscle twitching is flooding your brain with so much information it can't register the pain.
Okay.
So these are those type of nerves. Okay.
Got it.
So now if you have your muscle, you can overwhelm your nervous system with a muscle.
Okay.
The muscle is a minuscule amount of the number of those nerves compared to around your spinal cord,
Got it.
okay, in your spine. So if this area is not moving, you're literally 100% of the day getting an absent of information that your brain wants to have.
Okay.
So your brain is now like, what is wrong? What is going on? So it's always trying to figure out what's going on. So then your brain, every time you enter any situation, it's thinking there's something wrong. So it's always shifted towards fight or flight.
Got it. And that's where you get stuck because it's
Yeah.
just
Yeah.
that, which is what we feel, right? When we feel sad or we feel anxious or we feel like that's all we feel. We don't feel anything else. So I imagine that's how you're.
Well, and especially with kids with disabilities or autism or kids like we're talking about
Right.
on the show is they're always like that, you know? So
Yeah.
for him to be able to go in and say, oh, okay, I see this pattern. This is an unusual pattern. We have to unwind this pattern first.
Exactly.
So people with like cerebral palsy or seizures, same thing. And I think that's the easiest way to explain. I always explain to people, are like, well, what is it then? It's not chiropractic care, it's energy work system. Like, no, it's still clinical chiropractic care, except for the clinical application on how it's applied is different.
Okay.
That is the easiest way to explain
Yeah.
neurological chiropractic compared to muscular skeletal. It's just the way he's applying it. And then plus our CLA Insight scans that we do on all of our patients. That's what he's really going off of. So he's not just guessing and going like pop, 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 let's let me guess.
Right.
Especially with these children,
So
he's looking at the scans, right?
That's
And
where,
you
hey,
can
we're
kind of explain that.
identifying where is this confusion coming from?
Yeah.
And you clear up this confusion, the brain automatically can then focus on what it's supposed to. And it's harder sometimes for people to explain when you tie it to autism, ADHD, all these things. But actually, if you think of your nervous system always getting this noisy information, if you've had a stressed out, anxiety driven day, you go to every room, and all of us have had this day where I am just stressed out. Every situation you go into, your brain's thinking, hey, what's going to go wrong?
Right.
Okay. Think of that times 100 for this kid who's growing and developing, and every situation he's entering that. And so why do behavior struggles, so many things, lack of focus, all that, it's just the
There's so
same
much.
situation. And it's where, yes, it's helping the kids. And yes, this is also where it helps mom and dad, caregivers who are in the same struggle. It's like, hey, how do we simply help the nervous system organize information better so it can actually function the way God's meant us to?
Yeah.
And I'm a strong believer, hey, our nervous system is always meant to be healing and repairing us.
Which I think is so amazing because so many parents and myself, you come to these dead ends where this medication is not working, this care is not doing anymore, we're not getting anywhere in therapy and stuff. Is that, there is a hope and it does start from the central nervous system. And when you explain that to me, it was such a huge, like, okay, there is hope. There is a possibility, even if it's a little bit, right, here and there. I mean, it's all progress instead of regression, which we get a lot as single, as parents that have special needs is like that regression period. And we're starting over again, or medication will work for a little while and then it stops working. And, then you have to do higher doses when it comes with all these side effects. So this holistic care that you offer is so important to me. And I know a lot of parents out there that don't want to do conventional medication is such a huge, hopeful thing that we have
Yeah.
now.
I also think that all nervous systems are different, just how we're all different, and they're all going to heal differently. So when we see healing happen in our office, like, our 26-year-old autistic boy, he not supposed to be able to talk, and doctors say, oh, that's never supposed to happen, especially his age, right?
Yeah.
But to be able to see those miracles happening.
That's
But
amazing.
like Dr. Price said, we can't put a limit on their nervous system when they have these certain disabilities or neurological issues, because the nervous system is going to heal how it wants to, but we're all different, just how we can grow muscle different, or how, all of us are so different. And so that's why I think sometimes the medical system putting a stamp on people saying, oh, this is your diagnosis, this is your future. That's what we don't like in our office, because we believe that there is hope and healing for all of these kids.
And I love that. That's what we need because, again, going back to just doctors telling, I remember when Riley had his last EEG and he had over 200 seizures in a 24-hour period. And the doctor literally folded his arms. I will never forget. He folded his arms in the doorway and just looked at me. Didn't even come in the room all the way and said, there's nothing more we can do. Like, this is just going to be your life. This is going to be his life. And I'm just like looking at him like, are you kidding me? Like, there's just no way this is going to be his life,
Yeah.
And so just those things where
But the bravery of the moms that come in, it's like, no, we know, right?
Yeah.
We just know, like, no, this is not their diagnosis. No, this is not their potential. How
Well,
are you going to sit
shortly
there and tell me
after,
that?
I took him off all the medication cold turkey, like literally stopped taking everything because he was like on 20 different medications, and I'm like, okay, there's 20 different, this huge cocktail, and none of them are helping. And all of them are either going through his liver or kidney or both. I don't need those to malfunction now and, like
Yeah.
damage those. So I took him off everything, and I was, I upset a lot of the doctors because like, you can't just do that. And I'm like, well, I did, it's not helping. And guess what? I mean, and again, I'm not a doctor, so I just used my instinct, and I did what was best for us. I thought at the time, Riley started progressing. They no longer thought he was going blind. He was able to track and follow now when he, at his follow-up appointment. The medication that he was on was so had so much sedation to it that he was like a rag doll. He wasn't tracking and following. He couldn't look at me when I was talking to him, so they thought he was losing his vision. And then it was slowly that he was starting to like smile, and he started having a personality back and stuff because all that stuff got out of his system. And my boy was coming back, who he was prior to getting injured at 6 months. And so that was a huge thing. And then we were able to take the feeding tube out. So he was able to drink liquids and stuff. So all these things happened after taking him off that medication. So, and then when he started seeing you, there was some big changes as well.
Yeah.
But what I do like about you as well is you explained to me that just because you have all these problems, or Riley has all these problems at one time where like maybe he's been sick or maybe he's had this and that, you don't adjust everything on his body at the same time. Like maybe my hips are out, maybe my shoulders out, my neck is out. He's like, but you explained to me, I'm not going to make all these adjustments because that's just going to put you back into fight or flight mode. So will you explain how that works and what your philosophy is there?
So one of the biggest tools Kerri mentioned earlier, I use what's called these Insight CLA scans. Gives us a lot of different information. One of the biggest things is called your heart rate variability. So heart rate variability is directly correlated to what you can call your vagal tone. This is how adaptive your nervous system is to change.
Okay.
So if we're able to go and get these scans and we can look and see, hey, someone's really adapting well, then they're going to handle that adjustment faster and respond faster. Now, if we see they're super fatigued and overwhelmed and their nervous system super tired, one adjustment is really difficult to adapt to.
Okay.
Okay.
Mm-hmm.
So we're giving the nervous system information when we give an adjustment.
Okay.
And the nervous system's going to organize and use that information according to what it can handle. So if you have a fatigued nervous system that cannot handle all this information, and then you give it a ton of information, it's just like going into a classroom that you've never learned anything, being expected to learn it all. You're just stressed out and overwhelmed.
Okay.
So this is a lot where finding, hey, where can we actually focus that has the biggest benefit and also is the primary area of your nervous system struggling? So using those scans, identifying those things, and then using those scans, hey, this type of technique is actually what your nervous system is going to respond to. Then we're actually able to make a huge change with a very small area.
Okay.
And that's what the nervous system's actually needing. It doesn't need to be pop adjusted in every single area. It's just way too much information and it can't process it. So now it's too stressed out because it's got too much information coming in
Right.
at
So
once.
it's like overwhelmed, just overwhelmed all over
Exactly.
again.
So that's also why when moms come into our office, or even, very holistic moms, they're like, oh, I'm doing this detox. I've done this liver thing. We're doing gluten-free. We've done brain-based therapy. We've done neurofeedback. And they just list all of this stuff. And then they tell us, but my child's not progressing. They just feel so worn out, exhausted. Or just like, you're saying, I've done this, and it's just not working. But why though? Because it's information input to the nervous system. And if their nervous system is stuck in fight or flight or exhausted, or the gas is ran up and they're just, charged,
much, yeah.
nothing that you're doing, not saying those things are bad, but, or we have adults that are like, I'm cold plunging, I'm doing this, I'm doing that. None of those things are bad.
Right.
But I also think we also know why they're not working when they come into us and say, but I'm doing this and I'm doing that and I'm doing that. I don't
So-
understand why it's not working. Well,
Perfect example.
yeah.
I have a patient he's been seeing for several years. He's a young guy. He's had some recent concussions and different things. So got him in some testing, brain balance testing, vision therapy, all these things that, hey, we got to help your brain recover. There's things he needs those therapies.
Right.
Okay. So we got him to where his nervous system was doing really well. His heart rate variability is high. I'm like, hey, let's start with one of those therapies. So he started in this brain balance therapy. Okay. And he came in and we were doing his re-exam. Mom expressed he was really struggling. He had a week where he was just having a lot of outbursts, attention issues. We did his scanned and everything, and his heart rate variability had dropped down, and all these things were going on. And he's doing an amazing therapy that's important. But it was taxing and stressful for his nervous system. And so I had him keep doing the therapy because it's actually really working. But he was supposed to start his next therapy on top of that. And so I'm like, let's push back that one because he's barely handling this one. So it doesn't mean those therapies aren't needed, like she was saying. They're amazing. But if you layer too many therapies, too many things, and this is what parents are caregivers, you're like, I want to heal my son. I'm going to do everything I can.
Exactly.
Yeah.
It's just the
Yeah.
same
Yeah.
thing. Even medications in their place can be super benefit, but 20 medications. Well, of course, he's overwhelmed, can't process any of
Yeah.
this, and his nervous system is now super overwhelmed.
Yeah.
And one of the biggest things that actually can trigger seizures even itself is an overwhelmed nervous system.
yeah.
Seizures, it's whole, we
Yeah.
won't get into a lot of the fun stuff there, but
Yeah.
it's an overwhelmed nervous system flooding so much information. The brain is overwhelmed. So, of course, you're seeing symptoms elevate.
Right.
And sometimes that can be seizures.
Well, and from my experience again, because that's how I met you, so that's why I wanted you, because I tell the story to my friends and people that have issues and stuff, right? But to actually hear it from you. But, I came in going through menopause. And at the same time, I had just put Riley in a home. So there was a huge life change. And my hormones were out of whack. And I had never had issues with hormones, as a woman. Like I never had PMS. It was regular, like no issues whatsoever. So I had no idea what hormones could do to your body. And at this time when I put Riley in, I was super, lost my whole identity. There was shame, there was embarrassment, there was just the fact that, he wasn't there and I thought I would take care of him for the rest of my life. And so it was a huge decision for me to put him in a home. And then on top of having menopause and, I went to a doctor and they put me on some creams and stuff and it seemed like it'd work for a while and then it wouldn't work. And it was extreme. The hot flashes I had were so horrific. Marty, my husband, would put his hand on my leg at church or something. He could just feel my body get hot before I even said anything, and he'd take his hand off right away. He's like, "Okay, I know not to touch you right now." You know, it's just like, don't even look at me.
Start growling
Don't
at
breathe at
him.
me. But
You're breathing too hard.
yeah, I can feel that hot air on me.
Yeah.
But I remember going to you finally. I'm like, listen, like none of this stuff is working. I mean, I'm on antidepressants because I can't get out of this. And I did need that at the time because I know that I need to get through that. I was absolutely suicidal. I mean, I even wrote letters to my son because I can't live with the fact that I'm not taking care of Riley anymore, you know? And so it was a very hard time for me. But then coming in and seeing you and you explaining like, hey, you're not able to absorb any of this because you're stuck. Look at where you're at. You're so stuck, Michelle. So
Yeah.
explain that in hormones for women because
Yeah.
that's a big thing. And I honestly, that was a life-saving thing for me in all aspects.
The wonderful thing about what I do looking at the nervous system is I'm not the hormone doctor doing labs, doing all these things because those are needed. But what's underlying controlling the hormones as you're supposed to be adapting to it is your nervous system. Okay. So the wonderful thing about being a man, I don't have those,
right.
but there's so much that is being controlled and changed. Okay. And if you have a nervous system that is overwhelmed, tired, and can't adapt just to normal things, and then you add, hey, now I'm going to add this life-changing event of menopause and going through all those massive changes
Right.
to an overwhelmed nervous system, of course it's not going to handle and organize all those things.
Right.
Okay.
So somebody that maybe doesn't have as stressful of a life, or somebody that doesn't have, or maybe they've had, they've not as out of whack as or as quickly, right? Like, I mean,
Yeah.
I was like, I think it was in June of 21. I went to a doctor to check, and he's like, "No, you're definitely not on menopause. You're fine." I just hadn't had a menstrual cycle because I was bodybuilding at the time, and so I think I had a very low body fat, so I just wasn't. And so I'm like, "Okay, that's great." He's like, "You're fine." Literally, 6 months later, it was like overnight, and so there was no like little buildup. It was just so immediate and so overwhelming, and it was very hard to even. You have the brain fog, and then you're not sleeping, and then you have these other life events on it. So I think that for women to get chiropractic care as they're getting older is just to maintain and not to try and fix something. So the maintenance of it, and not just for women, but for men too. But I really think
Yeah.
that so women start seeing these changes and they go and get their blood work and they're able to adapt to the things that they're given, the therapies that they're given, versus for me, I spent a lot of money on things that weren't working, and 2 years of not getting any kind of relief long term. It would work for a while and wouldn't work. So I really encourage women to get into therapy or chiropractic therapy early in their life, 20s, after they have pregnancy.
Yeah. And pregnancy.
You
but
know,
yeah.
Yes.
after
I
pregnancy.
say-
And then as you get older, and I say older, like late 20s and 30s, and it seems like women are going through menopause a lot earlier. And I think maybe it's a lot of hormones in our
Yeah.
Yeah.
food and
Well,
things like that. So
there's so many things that we're always getting attacked with, whether it's food issues. I mean, attacked may be not the right word, but there's so many things our nervous system's always dealing with.
Right.
And this goes to where actually I have so many people that one of their big issues there with chiropractors are like, these chiropractors want you to see you forever. And yes,
Yeah.
it's a maintenance.
because
Yeah.
when are you stopping to deal with stress in your life? When does the stress
Right.
go away?
Right. And where
You-
does the air traffic control system,
Exactly.
the nervous system, you want it to just stop working?
Right.
And
So
then all your organs, it controls
This
your
goes
organs,
to,
everything. It doesn't
like
make
you were
sense.
saying, maintenance, wellness. Hey, how do I make sure I'm functioning at my best?
Yeah.
And how do I make sure that's happening? So another thing I use the Insight scans for is, hey, get you at this state where we call it a ready state, where your nervous system is ready to adapt to life. And then check a couple times a year and make sure we're staying in that state and you're doing well, because life happens.
Well,
So-
I look at it like exercise, right? Like some people exercise once they've gained too much weight and then they're trying to catch up, and it's harder because
Yes.
it's so much easier to gain weight
Yeah.
than to lose weight.
Absolutely.
But if you're able to just kind of stay on track and maintain your health and maintain that physical activity and things, I think chiropractic care is the same way. It should be part of that wellness where you're like getting your maintenance and before things go backwards and then you're trying to make up for it. And I wish I had known that when I was younger, honestly. I
Yeah.
think it would have saved me a lot of time and effort of my migraines would have been gone. I probably had a brain tumor and had brain surgery. I probably wouldn't have 2 torn shoulders. I mean, the things that just happen because, like you said, life doesn't slow down. It doesn't, you don't stop having stress.
Exactly.
And it's all relevant to anybody that's going through it. But having that maintenance, I think, is just so important. And when you're looking at the big picture, you
Yeah.
know, the cost that it costs to go to a chiropractor and maintenance versus these big medical things that can happen later on. That's in, I mean, what would you rather do?
Yeah. Well, and
Yeah.
just the difference, we talk about this all the time. We actually, we have a doctor that actually sits down with you and listens to you. You're not just a number. He spends a lot of time with you, going through your history, going through even how you were born, came into this life, or if you have a baby or a child with disabilities, going through that history of actually spending time with you. And that's compliments we get all the time in our office, is that this isn't like a regular, even chiropractic office. You don't just come and get adjusted and you leave. It's like the doctor is actually taking so much time with you. And you should, because we're all different. And I think this leads into talking about one of our patients. I love her story because mom of 3 boys, I believe she had Crohn's and lupus,
Yes.
lots of autoimmune, and all these tests coming back that she's going to have this for the rest of her life, and this is her life. And this woman's coming in a walker, almost a wheelchair,
She was in a
and
wheelchair.
thinking like,
Yeah.
I cannot live my life like this. How can I raise 3 boys?
Mm-hmm.
And how can I do this? And I'm sure you can relate, Michelle. I'm sure I even can relate of some of the things that happened in my, how am I going to do this? How am I going to live like this? And being able to, I mean, we had to see her a lot.
So-
her care was pretty aggressive. We call these intensive cases that we deal with in our office. But now, I mean, she's one of our biggest testimonials. You would not even believe what she looks like now
Wow.
and how
So
she's
many- just give me
functioning.
chills.
She's like, I'm jumping on the tramp with my boys. They told me this was never possible. They can't find traces of her
Yeah, her
Crohn's.
last.
And all it was her nervous system was literally so stuck. I think she was one of our highest. We give you your nervous system a core score. I think she had one of just the worst.
When we
Wow.
talk about her heart rate variability, several markers, her nervous system was just in the tank.
Yeah.
So fatigued. And they'd done everything and gone through so many therapies. She was in a wheelchair because she couldn't move without triggering issues. She was developing decubitus ulcers.
Wow.
So
Yeah.
all these issues. And her last checkup with her digestive doctor, I just having a brain fart. Gastroenterologist.
Yeah.
They did a scope of everything, and he prepped her. He's like, "Hey, before we do this, I know you refuse to do these medications before. You're going to have to because it always goes this way." And they did the scope, and then he came back in and he said, "I can't find anything."
Wow.
So
Wow.
So really knowing your nervous system can
Yes.
heal that. I mean, I think people think it's woo-woo, right? Like, oh, your nervous system can heal your digestive system. Well, it's all connected. So why not? But I think we've been so programmed to believe that you have to have this medication or this is the outcome. Or kids with disabilities, like to get that diagnosis, your child has autism. Okay. But we're not going to take that diagnosis and just pin it on them. There is hope. There is healing. Your son or daughter could speak. Your son or daughter, maybe they haven't been able to walk, but there is hope for them. We just had a little boy in our office, never been able to walk. And now he's taken his first steps. Yeah, is he still wobbly like a drunken sailor? But he's never been able to, so his body's trying to learn how to do it. So to be able to have that hope and there is healing and not to just put this diagnosis on yourself or your child. Because, I mean, I know for me as a mom, you're just the same. Like when I got that diagnosis of like, they thought, oh, maybe your son could be on the spectrum. I mean, my light bulb was like, no, there's no way because he was a normal, healthy kid. So something's wrong. Something's happened,
Yeah.
But I think sometimes, and maybe you could speak to this, I think moms just get so exhausted. They just take it, right? And they just say, okay, I guess this is just going to be my life.
Yeah. I remember Riley was 6 months old and he was perfectly healthy and normal and hit every milestone and, got a clean bill of health and had his vaccinations. And 2 days later, he started having seizures. And even the seizures he had I didn't know there were different kinds of seizures because I'd never been around them. So I was completely oblivious to what they look like or what have you. But I remember it was an evening where he had had a late nap. And so I got him up and I put him in the bathtub with me and it was warm, and he's on my knees and we're like looking at each other and cooing and he's just being so sweet. And I remember him looking off to the side and then he just did the startle, like he just did this little flinch and it looked like a startle reflex, which babies have, right?
Yeah.
And I'm like, okay, that was weird, but not, it wasn't abnormal, you know?
Yeah.
And then he did it again, like a few minutes later. You know, he was like looking at me in my eyes and just looked to the side and then startled again. He did it
Oh.
3 times. And finally, it was so weird that I looked behind me, like, what is he seeing that's scaring him? Because it was kind of spooky. Like, he's completely interactive with me, looking me in the eyes, and then goes off to the side and startles. So I'm like, well, maybe he's just tired. I mean, maybe, he's growing. He just, he had his checkup and stuff. And so got him out of the bathtub and put him down for for the night, and he went to sleep. The next morning, his dad got him up. I was making breakfast and fed him, and then his dad was walking him up and down the hallway to put him down for his first morning nap. And he came back downstairs. I remember cleaning up the kitchen. And he goes, hey, he goes, I don't want to freak you out, but Riley was doing this thing that was kind of spooky. And right when he said that, I knew what had happened, right? I
Right.
didn't know there were seizures though, but I'm like, what is it? Like, this is freaking me out. And so
Mm-hmm.
I called, it was President's Day weekend, so it was a 3-day weekend. So the doctor, our normal pediatrician, wasn't working. So I called the on call doctor, and they said, well, sounds like he might be having seizures. You need to go get him checked. And I'm thinking to myself, like, what? I'm thinking grand mal seizures, right? Like convulsing things, like not just
Yeah.
little, you know, things. So I remember telling his dad to get the video camera. I said, I want to make sure that we videotape it in case it doesn't happen again, that we can show the doctor. And so we went to the emergency room. As we were getting checked in and stuff, Riley started having them again. He was starting to do these things again. And it was progressed from like 3 the first night to 12 the next morning to now they're like 10 minutes long, where they're like, he's just like kind of doing this thing, you know?
Yeah.
And so they got us to the back and they did the CAT scan to make sure he hadn't been shaken or dropped or anything like that. And then he went into another cluster. So it was like these clusters were building. I mean, it was like, I mean, I'm talking like 10 minutes to now it's
Yeah.
20 minutes, 25 minutes. And he'd have them. And I remember the doctors coming in, and there was a resident and an emergency room doctor. And they looked and it says, it looks like your baby has infantile spasm syndrome. And I'm like, what? He goes, give him this medication, bring him back on Thursday. This was a Friday night. Bring him back on Thursday and we'll do an EEG. I didn't know what any of these terms meant. I didn't know what
Yeah.
any of this was. I was just like, what? So I did the worst thing any parent could do is I went home and Googled it, right? And it says catastrophic form of epilepsy, mental retardation, 90% of the children will never walk. The first few sentences. And I'm sitting here going, and you gave me a pill to give him for, like that's it,
Yeah.
no explanation.
Yeah.
So the fear that you have, right?
Yeah.
And then it took us 3 years to even get a diagnosis. And so just chasing that next thing, like
Yeah.
I knew as a parent that as long as I had something to do to like go to next, right? Like that I felt like I was doing something, there was progress. And just the medications, I took him to Detroit and I remember to the specialist there, Dr. Shugani, his wait list was like a year long to get in with him. And I remember sending flowers to his receptionist every Tuesday. Like, please don't forget me. If you have a cancellation, please let me know. And so finally she had a cancellation and went there. But like you said, you just do what you have to do and you do what you're told. And I thought that adding these medications would help him. And they maybe some of them were, but there was,
Yeah.
like you said, now it makes sense that his body was probably so overwhelmed with so many medications that it weren't. And I'm not discounting doctors at all. And they call it practicing medicine for a reason. Like they're not miracle workers. And a lot of times they get miracles, and I think miracles can happen. So I love all the doctors that we worked with, and I think that they
Yeah.
did the best that they could. There's definitely not a one fits all, like, okay, like just because one medication helped this one with the same diagnosis doesn't mean it's going to help. Because going back to what you said,
Yeah.
we're all built different. We're all going to like metabolize that differently.
Yeah.
But what I did like is that I found a natural path that worked with my doctor. And a lot of times that doesn't happen. And I think you're definitely the same way, where it's like, hey, we understand conventional medication is needed and some of
Yeah.
these medications are absolutely needed, but let's put your body back to baseline to where they can absorb it and we can get this helped. And so I think my experience with the naturopath and working with you guys is really very similar, because you're like, we understand that he has to have these therapies. We understand he has to have
Yeah.
these procedures or these medications, but let's make sure that his body's able to adapt to that and receive it the
Exactly.
way it's supposed to. And I
Yeah.
think that's what a lot of parents need to understand is like, this is something that we can work with and help and not be against, because I think a lot of times they work against each other. Like doctors don't respect chiropractors don't respect doctors. And I don't feel that with you at all. I feel like you've been very open with your own experience with your brother and, like you said, your child,
Yeah.
but also with just you seeing what has happened, and you know what you know, and you know the central nervous system, which
Yeah.
is what we
Yeah.
I
Did you have
think
birth trauma with Riley?
No, with my other two I did, but with Riley, he was fast. I mean, it was crazy. Which yeah, so that's a
Yeah.
whole nother
Yeah.
thing.
I was like,
Yeah.
Yeah.
because
Curious about that because sometimes fast births too.
and that's
That
maybe what it
is,
was. It was fast.
Yeah,
yeah.
super
So
fast births can be sometimes more traumatic than the
yeah,
slow, long drawn out birth.
And I can tell you that, so Tanner was my first, and had him in Guam, so there was no anesthesiologist. I had to make an appointment, and then he was 10 days early, so that wouldn't have helped anyway, right? So,
yeah.
but he was stuck, so forceps and the vacuum. All three boys, actually, yeah, Riley did have trauma because he broke his collarbone. So all three of my boys broke their collarbones coming out.
Yeah, see, so
But
that
Riley's very
it's all
fast, yeah.
making sense. And so I think that's what I feel like Christian does a good job on speaking to because I feel like even with my son, that was like the missing piece. I was like, he's already getting chiropractic care. Like, I eat a clean diet. We do all of these therapies. We're doing all this stuff. Like, why is my son struggling so much? But then going back to my son's birth, is he had the vacuum in the forceps. Okay. And I think that's one thing that other chiropractors don't do, but the PX model of what we teach does is that we focus on that birth trauma or like, how did your son or daughter come into this earth and how was that process? Because that sets the tone for the nervous system through your whole life. Right. And so if we can't get in there early and get some of the things like corrected, like I just was talking to a mom the other day, she's like, oh, this is hereditary. The ear infections are hereditary. This is hereditary. And, my nervous system's in shock. I'm like trying to just listen because I try to just listen. Yeah. And I say, oh, tell me more about that. Tell me more about their birth process. She's telling me all about her birth and my like light is just going off of like, I know now why your son is struggling with lots and lots of anoid and ear infections because it makes sense on how he was birthed. And she was like, how does that have anything to do with it? No, it's hereditary, And so I think if you could explain a little bit more about birth trauma, especially with people who are listening that have children with disability or autism, I think it will all come full circle because that's how it came full circle for me of learning about that birth trauma.
Yeah.
Well, a lot of it, I mean, you can go back to so many different things, even before birth trauma. Is also, hey, how is life as you were trying to get pregnant? And there's some studies that were just released recently just going over, hey, if mom and dad, because dad also, if he's stressed out, is starting to set the stage of literally a nervous system being stressed, growing and developing. So then if you're going through this pregnancy and mom's stressed out, that's training the nervous system to grow in this fight or flight state. Wow. Yeah. Then if you layer, hey, then there was some extra interventions with birth, or it was a very fast, rough birth. I remember, our fifth child, fastest birth you could imagine.
18 minutes.
Oh, gosh.
Start to finish.
Amazing, but not amazing.
Yeah.
Exactly.
She was the most bruised up child. And we've had one with a broken collarbone. Our oldest had forceps and vacuum. And so birth, there's so many varying things. But if you look at the birthing process, if everything goes perfectly according to plan, there was a study done by osteopaths where they were looking at just infants, and for the study to be included in the study, they had to have no forceps, no vacuum, no induction, nothing. So, quote unquote, a perfect birth. Okay. And they found in 99% of all the children that they examined, they had restrictions in their range of motion, especially in their cervical spine.
So, and those were
That's
were
quote unquote
considered like
normal.
perfect births.
Okay. Yeah.
So now you add layers of, hey, there's other things that happen through the birthing process. And then you start looking at how that infant's muscles know how to stabilize. They don't.
Right.
Okay. And especially often, like one of the biggest questions that I ask all the time of moms is, hey, who delivered your baby, a midwife or an OB? Okay. One of the biggest problems with our medical system is doctors are overwhelmed. Okay. They can't be there as long enough. So that OB tendency is in a hurry because he's got 5 moms delivering.
Right.
So when the baby's coming, he's like, okay, good, we're going to get him out right now. Yeah. So which means they pull and extract, and they're trained to rotate, hey, get the shoulder. Now, what does that do? You have the upper cervical spine, that C1 doesn't have joints to stabilize that vertebra. Okay. But it's rotation that it allows, and then you're twisting, rotating. So you can create trauma just literally assisting right there. Wow. So
which is what they're trained to do.
That's what they're trained to do.
Right. And they're often in a hurry too, because they're asked to do so much. So it's not even saying they're doing a bad job, or maybe that was needed to help. And that's just the most gentle thing, not adding a big old vacuum, which is basically just a suction cup they put on the baby's head, if you're not familiar, and then pull, okay? Or forceps, which is much more aggressive, okay? And that's where a lot, I think the biggest issue in general with the medical system is we look and try and mechanize the process to help it be more functional with a busy schedule.
Instead of let's get you in a right position. So I remember when I was birthing one of my daughters, the midwife's like, let me get you into this position because it looks like she's stuck and I don't want to put my hands on her. I just need to be able to assist her out. So she's like, let's go ahead and put your leg up because I really don't want to pull. But then when her shoulder got a little bit stuck, she's like, I'm going to have to do, but she looked at my husband and said, you're going to have to adjust her because if I do any sort of assisting, that's pulling on the nervous system and it's creating stress for the baby. And I don't think moms realize that. And I want you to know, we're not shaming moms who've had C-sections. We're not shaming moms in any of your birth experience because birth in itself is just hard. And it's just this, women are amazing, right? We go through. It's
more just raising this awareness. Just like that midwife had trained and gotten used to seeing it. It's like, hey, this is something you're going to want to get checked after because, hey, it didn't go perfect according to plan, so we want to get it checked.
So how early can you see a baby, like a newborn? Like, are you talking days or what's?
He's seen him hours
old. As soon as you're comfortable is what I usually tell my patients.
Well, speaking from parents, so I think like, we don't want anybody to touch our baby. Like we're, afraid. So I think we really want to explain what the benefits are the earlier you see
the benefits and understanding it. Example I often actually share is our youngest. She was born at the hospital. I mean, we could go through a long story with things there. She came early and everything. And she came so fast, I wasn't even able to get there for the delivery. So I just went straight to see her. She was getting checked out and everything, and they were with the nurses. And then the nurse was just watching me, and she's like, I've never seen a dad hold her baby like that. And I was like, well, I'm actually adjusting her.
Oh, wow.
And she thought I was just holding the babies.
Okay.
And it was literally, she was only 30 minutes old.
Okay.
So, and I was just with my pinky, literally just helping adjust her right there. Wow. So to the point where the nurse had no idea I was even doing an adjustment because it's so gentle.
But it's because she had the birth trauma.
She had the birth trauma, so she definitely needed it.
So the earlier the better, but we sometimes, it's just when mom's comfortable. Sometimes they're like, I want 2 weeks to just breastfeed and be with my baby, and then I can bring them in. But our moms who kind of really understand, we've had moms be like, I just had her and things did not go right. And I just need you here because I can already tell she's not sucking. This is going on. Can you please get here? And we've done house calls so we can get that.
So that's one of the things I do personally to make that process easier, because one of the biggest things is, hey, you don't want to get out. You don't want to do all those things. And I want to get there as soon as you're and that's where I say it's mom and dad's comfortability. Okay. Unless there's something that we know happened, I'm not going to make sure, but I'm going to encourage them as soon as possible. And I want to make it as simple as possible. So I do home visits after, because then it takes away one obstacle so where we can check and make sure they're doing well right away.
So somebody that has a hard time with breastfeeding, is a lot of times that's something that chiropractic can help, where they're not latching on and things like that. Because I think a lot of women want to, and again, there's nothing wrong with people that don't want to, but the ones that do, I know that, for instance, my daughter-in-law, she wanted to, but she just had such a hard time with Cash. Like, he just would not, and so she gave up within a couple of weeks, and I mean,
So breastfeeding, it is the number one thing I ask to gauge how the infant's doing. Okay. Because just simply for yourself, if your neck's sore, how easy is it for you to tip back a glass and drink water?
Right.
Okay. Now think of engaging and using muscles you have just learning to use for the first time. Okay. If your neck isn't moving well, you're not engaged and use those muscles properly. It's uncomfortable. So one of the most benign questions I would ask mom, they look at me weird. I'm like, oh, so which side were they better at? So if an infant's struggling, they're literally it's going to be easier to do it on one side. And then mom's always like, no, I just produce more on that side. No, your nervous system was stimulated to produce more because he was engaging and latching properly from one angle. And why was it not from the other side? That's what we get to start looking down. Hey, what's going on? Why was the latch so hard? And there's so many different elements to it, but it's literally just a sign of nervous system struggling in this position.
That totally makes sense.
And that was
So,
happening with our son. That's
Yeah.
one of the first cues I noticed. I'm like, he's like struggle breastfeeding. He has colic. You know, I was running the vacuum all night just to get him to sleep.
Yeah.
I was putting him on the washer, going around driving.
okay.
Trayson's,
you
Which
know,
a lot of parents do.
yeah,
Mm-hmm.
and but we think it's normal. You know, I
Yeah.
was told this is common, this is normal.
Yeah.
Some babies just have colic. Some babies just cry more. And I mean, I don't even know why I had another child after him because
It was a,
he was hard.
Yeah.
But then we look back at his history. He is my child that had the vacuum and the forceps, and he had.
okay.
And I look back, I don't even know why the OB used it because we look back at the history. I
he
was
had several
progressing
rooms. He was in
fine.
the same.
I was doing just fine. I honestly just think he was in a hurry because there were 5, 6 other
deliveries.
deliveries that
And he
night.
said he had other ones.
And
to
again,
do,
first time mom, I don't know,
Right.
you know, what's going on, but so much trouble nursing.
So,
And
but a lot even going back. We're young parents. I was working on I was just in barely in college, not in chiropractic school or anything. Made every mistake looking back. I'm like, oh, we did this wrong. Kerri was induced because we wanted to fit with our schedule better. So why was the labor harder? Why did well, we weren't following what we should have been working with to help her body. We were like trying to fit it with our schedule. So of course it was more complicated. And then like Kerri said, he had several obligations at the same time. So he was in a hurry. And it had taken a long time because she was induced. So maybe he was a little impatient because it had taken a long time.
Right.
yeah.
So that's where maybe those were things. And I didn't know better at the time to say, hey, no, don't do that.
Right.
And of course, that's where I relate a lot with parents, and because it's easy to look back and shame yourself.
Yeah.
Hey, I made this mistake.
always our
Instead of
fault.
it's like, hey, I was operating on the information I had at that time.
Yeah.
And so I was doing the best according to what I understood at that time. Looking back, I didn't understand anything. But
Yeah.
Yeah.
Well, and
That's-
still being a chiropractor, because
that's-
really where our story
can-
goes into is I took my son to a different chiropractor. I took him to a pediatric experienced chiropractor because he was being stubborn and wasn't listening to me. And I was like, hey, I think this could really help our son. You know, all these things are getting worse. Like he's not getting better. And I'm doing the diets. I'm doing all the detoxes. I mean, poor kid. I took him through the nines.
Well-
You know, I just was trying all of these things. Like, no, I'm not going to settle for this type of diagnosis or whatever they thought that he had. And he was really struggling. And then I started, you know, Dr. Tony, I just started binge watching all of his stuff. And I was like, I think that this could really help our son, Trayson. And it wasn't that chiropractic in general was bad that he was getting. But again, how we can explain it is it wasn't applied clinically how Dr. Price does now of what his nervous system needed to be able to start to heal. And then once he learned that and we started to applying that to our son, he started to get better and he became a whole different kid.
Yeah.
And so I think that that's what I want moms to realize is that it's the clinical application of how chiropractic is applied on how it makes it different. And it made a whole bunch of difference for our son. And I made Dr. Price go to day 2 with me to this other chiropractor. I said, you have to come with me. And
How was that?
It was
he's like,
eye-opening.
you're cheating on me in a different way, right?
It
Yeah.
was one of the biggest lessons, even back to one of your comments earlier. It's like, hey, you're one of these providers who's willing to work with other providers. And that was a wake-up lesson to me because I was working and mentoring in this other office, and the philosophy in this other office was, hey, you're supposed to be everything for everyone. You're supposed to know everything. They're supposed to always come to you for everything, for nutrition, for everything. So we were trying everything to do everything for Trayson as he was struggling. And one thing I've really come to believe, if you're trying to be everything for everyone, you're the jack of all trades, the master of nothing. And this is why his chiropractic care sucked. I was not using it, wasn't doing it correctly. I was just operating just like I do with all my patients coming in with back pain, blown out discs, all these different things. I was like, hey, here's where it's tight. We're going to adjust this. We're going to, oh, hey, I felt this tight too. So I'm going to adjust this. So I was adjusting everything I possibly could every time I adjusted.
Oh, hey, you need a supplement.
So,
Okay, let's get you
and
on
then,
that. Like, it's
yes.
just a whirlwind.
And so
Overwhelming.
then
Yeah.
it was like Kerri, it took my wife literally going and getting another opinion and going to that day too. It was like
I'm
having,
stubborn.
Mama. Yeah. Oh, I
it
know.
was a wake up moment. It was like
Yeah.
getting hit with a 2x4 in the
Yeah.
face. Hey, you're doing everything wrong. But the
Yeah.
awesome experience, and from Dr. Hafer, who's become a good friend of ours, it was like, you should do this. You can do this for your son. And so that's where I started looking and trying to train, and then started opening up all those things, and led me to where I'm focused now, and where I honestly believe, hey, this is where I am focused and working to become a better master every day. But those other things are amazing, but that's not what I'm focused, because this is what I can do.
Yeah.
Which
Well,
I-
let's get your nervous system in a place where it can handle that detox.
Exactly.
Because it might need a heavy metal detox. Like if we're working with a vaccine injured child, but that child is not ready for a heavy metal detox
Right.
if we see their heart rate variability is completely tanked.
Yeah.
I promise you can spend thousands of dollars on that
did.
detox protocol. And we did.
Yeah.
On that detox protocol, and it will not work. And I'm a testament to that because I did that with my son, and it did not work. And he'd get a little bit better, and then he'd go right back.
Yes.
But until we started really looking at his nervous system and him being able to apply that chiropractic care how it was supposed to, that's when we started to see it heal. And yeah, I mean, he's 18.
Yeah.
I mean, I think he's
Yeah.
maybe a couple months younger than Riley. And he is such a different kid, and I'm so grateful. And again, moms, if you're listening, like, really listen. Like, I was so persistent. I mean, I was so like, I have to figure this out, and so persistent that I was like, okay, I'm gonna go against my husband just for a second year, and I'm gonna try and figure this out. And I'm so glad he was willing to come with me, because I said, hey, you're going to this appointment with me. I went and saw Dr. Hafer. You're coming with me to come listen to this, because I really think this is the missing piece. And it really was the missing piece. And I'm so grateful now, because now we are able to serve all of these families.
Just so
And I'm
amazing.
able to relate to these families to say, like, look, moms, I know where you're at. I know you've tried this detox. I know you've tried this brain-based therapy. I know you tried neurofeedback. This is why it's not working. And I promise you that if you can trust us, come into our clinic, that we can honor this process with you. And no, sometimes it's not easy. Sometimes we're seeing children, he's sometimes adjusting them every day, twice a day, so we can get that momentum and see that change in the nervous system. But if you stick with us, I promise you, you can see miracles happen in your child.
Yeah. I agree with that. And I've seen them. So I think that's so amazing.
Yeah.
I always tell people, because again, going back to when I have blood work done for my hormones and stuff, it's like a good doctor will treat you. A great doctor will treat, it's a good doctor will treat the labs. A great doctor will treat you. Or is it the other way around?
Yeah.
To reword that. But
Yes.
you look at the labs and you're like, oh, I'm in normal range. Okay, well, I don't want to be normal. I want to be optimal. And so the doctor that wants to look at your labs and say, okay, I'm going to treat you as a patient. That's what I mean is that, okay, your labs are normal, but we want you to be over here. And that's where you guys look to is like, okay, yeah, we can do this adjustment, but we want you to run optimally. So we're going to do this, and we're not going to do these other adjustments today. We're going to focus on this, and we're not going to recommend that you do these other treatments right now until we can get your central nervous system back to baseline. I think that's so important.